All right, so today we're diving into a real classic OSCE station, and it's one that truly tests both your medical knowledge and your communication skills. We're talking about managing erectile dysfunction in a patient who has some pretty complex heart conditions.
Welcome to this clinical walkthrough on the erectile dysfunction case for the UK MLA. It's brought to you by Mediate, your 24/7 practice partner, and it's designed to help you absolutely master this challenging station.
Okay, so we're going to break this consultation down into 5 key stages. We'll start with the introduction and building rapport, all the way through to setting up a safe follow-up at the end. Think of this as your roadmap to absolutely nailing this station.
All right, so the consultation kicks off, and right away, you're faced with a challenge. The patient gives you a really vague opening, and it's your job to figure out what's really going on.
So the patient comes in and says something super vague, like, "I just feel rubbish." Now, this is a classic exam tactic, you know? They want to see if you can create that safe, confidential space that encourages a patient to open up about something that's often quite sensitive.
So the big question is, how do you get from that vague statement to the real issue here, which is erectile dysfunction? Well, it all comes down to your opening lines.
Let's look at some really powerful phrases you can use. You'll start with your standard professional introduction, but then you show empathy. And, this is key, you ask for permission to ask more questions. Then, once they do open up, validating their concern with something simple like, "Thank you for sharing that with me." Wow, that can instantly build trust and just lower their anxiety.
Okay, once you've built that rapport, it's time to move into the next phase, taking a really structured clinical history. This is where you're going to gather all the crucial details you need to make a safe and accurate diagnosis. So, first things first, you've got to really characterize the erectile dysfunction itself. These questions help you tell the difference between physical and psychological causes. For instance, if he's still having morning erections, that might point you towards a more psychological cause, right? Whereas if they've gradually disappeared completely, you might be thinking more along the lines of a vascular issue.
Next up, you have to screen for any associated symptoms. And in this particular case, remember, this patient has a history of heart failure. So asking about things like fatigue or shortness of breath, that's absolutely vital. It helps you get a sense of their overall cardiovascular stability. And please, don't forget the psychosocial side of things. You know, this isn't just a physical problem, is it? It has a huge impact on mood, on confidence, on relationships. Asking these questions shows you're treating the whole person, not just a symptom. So as you're gathering all this information, a picture starts to form. But the absolute key detail here, look under medications, is nitrates. Honestly, that one word is a massive red flag. It's probably the most important clinical finding in this entire station.
Now, before you even think about jumping into a management plan, you have to understand the patient's perspective. And we do this using ICE, their ideas, concerns, and expectations. A great way to get to their expectations is to just ask directly, "Were you hoping to try something like Viagra today?" This opens the door to a really patient-centered conversation about treatments and, crucially, their risks. Okay, this next part is arguably the most critical moment of the entire consultation, explaining the diagnosis and the huge risks that come with the treatment the patient is probably expecting.
When you're explaining the diagnosis, keep it simple, no medical jargon. If you frame it as a really common issue that's often linked to their heart condition, it helps to normalize the whole thing. It takes away some of that embarrassment or feeling of failure they might have.
Okay, this is the absolute crux of the case, the drug interaction. You have to explain this perfectly. Think about it. Nitrates work by relaxing blood vessels. And what does Viagra do? The exact same thing. Put them together and you get this massive combined effect that can cause a dangerous, even life-threatening drop in blood pressure. This isn't just a side effect, it's a critical safety issue.
So how do you explain this? Here's a really clear, direct way to phrase it. This sentence is totally unambiguous. It explains the dangerous interaction and gives a very clear reason for not prescribing the medication. The key is, you have to deliver this line calmly and with confidence. And remember, you can practice this exact case right now and get objective, personalized feedback on mymediate.com.
Okay, so you've just delivered some tough news. Viagra is off the table. But your job isn't done. In fact, it's just getting started. Now you need to pivot to a safe alternative and really holistic management plan. A really good management plan here is going to be structured. First, you state clearly, "I can't prescribe a drug like Viagra." And you can even mention that's based on national guidelines.
Then you immediately pivot to what you can do. You can offer safe alternatives, like a vacuum device, you can refer for specialist options, you can address the psychological impact, and you can tie it all back to improving his overall heart health. Now that is a comprehensive plan.
All right, we're nearly at the end. To wrap this up perfectly, you need two things: rock-solid safety netting and a crystal-clear follow-up plan. This shows you're thinking about the patient's long-term care, not just this one 10-minute consultation.
Your safety netting advice has to hit two key areas. First, you've got the psychological side of things. What should he do if his mood really dips? And second, you have to cover the cardiac red flags, basically reinforcing what he already knows about chest pain, but specifically mentioning it in the context of intimacy.
And finally, your follow-up plan needs to be concrete and actionable. Don't just say, "We'll refer you." Say, "I am going to make that referral to urology for you." Tell him you'll schedule a follow-up with the GP in about 4 to 6 weeks, and then reassure him that all his regular heart care will, of course, continue. This gives him a clear, reassuring path forward and shows you're really looking after him.
Go and practice his exact case now on mymediate.com. Honestly, mastering a station like this is what shows the examiners that you're not just competent, but a truly safe and empathetic doctor.